out there. This article was July 15, 2014, New York Times, Executive Pay at Hospitals. We're going to hear from some new voices, and we'll be right back to talk about cancer treatment at Radiosurgery New York. This is Dr. Lederman at 212 Choices.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices, 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212 Choices, 212 Choices for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212 Choices. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212 Choices.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and I want to talk about a man, 80-year-old man with a great family. Just 1 week ago, his son heard about us and called. His dad, 80 years old, was in the hospital for 2 weeks. He went to the hospital in New Jersey 2 weeks. They found a lung mass and a brain tumor, which you could argue could be found in about 10 minutes with a scan and an MRI. He was in the hospital for 2 weeks. They were going to give him whole brain radiation for the brain metastasis. The son heard about our treatment, that you didn't have to treat his healthy brain, and I don't think anyone wants to have their healthy brain treated. So the son called me on Sunday at the 212 Choices, and we actually arranged to meet on Monday. And then the doctor in New Jersey told the family, if he leaves here, he's not going to be able to come back here. I'm not going to take care of him. Well, thank God the family wasn't intimidated by that threat, which is totally wrong. Patients are in charge of their body. The doctor works for the patient. It's not the patient who works for the doctor. The doctor works for the patient. They came in last Monday. I saw him. He had swollen legs. He wasn't fine. He was in kidney failure. We worked him up for the swollen legs. Now, remember, the number 2 killer in cancer patients is not the cancer, and it's not chemo, and it's not surgery. The number 2 killer is blood clots. Now, this man had huge legs. He was sick. They put him in bed for 2 weeks there in that hospital. Didn't take him out. We checked him for blood clots, and he had multiple blood clots in both legs. I mean, thank God he came to us on Monday. We took care of it immediately so the blood clots wouldn't travel to his lungs or heart and kill him. The family was so angry. He'd been in the hospital, saw all the doctors there, all the doctors coming around and saw him. No one checked his legs. The family was so angry that he had to come to Radiosurgery New York to get a physical exam to find the blood clot to hopefully save his life. Furthermore, we found, of course, the brain metastasis, and we are offering brain radiosurgery, which is non-invasive treatment to treat the tumors and not the healthy brain, which appeals a lot to the family, appeals a lot to the patient, appeals a lot to me. I don't want my brain radiated for no reason when you can hit the cancer, and you hit the cancer with a higher dose that's more effective, less side effects, less hair loss, shorter period of time. Isn't that better? Isn't that what we're here for? To hit the cancer and not hurt the healthy tissues? We have a caller. Let's hear the caller, and then we'll get back to about this patient. Good morning.
Good morning, Dr. Lederman.
Hi. What's up?
Hi. Yeah, I spoke to you once before about my stepdaughter.
Okay.
Having the cervical cancer, and she was given radiation and chemo.
Right.
Right. So now I was not able to go with her. She was brought back to the hospital because she was having problems keeping anything down. And with her stomach, whatever, and so they found out that she has, after they gave her so much treatment or radiation and whatever, they found that she had floating tumor cancer cells around the liver. And now she has some type of blockage, but where she can't keep anything, no fluids or anything, and not going through.
Right.
So they send her back home, but they started her on a cocktail chemo.
Okay.
Right?
So what's your question for me?
Okay, I wanted to find out. I want to see if she has to be a candidate. These candidates.
Well, bring her in. Bring her in. I just talked a half hour ago about the woman who had metastatic cancer to the liver is in remission right now with radiosurgery. So your daughter would have to see. She should come in, make an appointment. We'll analyze her, see her condition. This is exactly the kind of work I'm talking about.
You would be able to find all her paperwork and whatever what she can...
We will help find all the paperwork. So just call during the week, make an appointment, 212 choices, and we will see her and try to do the best we can to help, okay?
I want her to see you before she gets her next chemo, which is in 3 weeks.
That's plenty of time. She's got 21 days. Plenty of time to see us.
I want to try to convince her to come and go in with
Don't have
me.
to convince her. She should learn the option. She's the president of the United States of her body. You don't have to convince her. You can tell her about us. If you can read the booklet, we can send her booklet, the DVD. If she's interested, great. If she's not interested,
she's
we
weak.
do the best.
She's weak from all this.
Well, she's weak. She had chemo, radiation, standard radiation, surgery. She's weak. Okay, give her...
I'm calling tomorrow and see if I can schedule an appointment to come in to see you.
All right. God bless you and thank you.
Thank you. Bye-bye.
So we were talking about this 80-year-old man with brain metastasis, with the blood clots. What else could go wrong with him? They missed the blood clots. They were going to give whole brain radiation when instead we could just do radiosurgery and save the vast majority of his brain from radiation exposure. We staged him up. He was in the hospital 2 weeks. They didn't do a PET scan. Well, yeah, they could pay the president $2 million or $4 million. Actually, the highest paid president of a hospital in the New York area is in New Jersey, who made $20 million last year. But they don't do PET scans because it costs a little bit of money. So we got this man staged up, and guess what we found? Not only is he in kidney failure, but his bladder was immense. He was not able to leave his urine from his body, and was backing up all the way to the kidneys. I put a catheter into him. I asked him what he wants to do, if he wants to see a urologist or want me to do it. He'd been seeing a nephrologist for 8 years. No one ever checked to find out why his creatinine was 3 in kidney failure. We got everything done, put a catheter in. 1,200 cc's of urine came out, about 6 times the normal amount, and he had just urinated. So in fact, there should have been none. So we're taking care of his kidneys, we're taking care of his blood clots, we're taking care of his brain, we're taking care of his cancer, and the family is happy they have someone that they can communicate with and is an advocate for the patient as an outpatient. So that's the kind of work we do. It's an example of the work we do, that we try to take care of the whole patient, to whether it's a blood clot or protecting the brain or diagnosing things that have been missed before. That's what we try to do. My name's Dr. Lederman from Radiosurgery New York. Our office is at 212-212-CHOICES, which is 212-246-4237. We're located at 1384 Broadway and 38th Street. We take most insurances, Medicare, Medicaid. We will fight for you if that's what you wish. We have urgent cancer consultants where we promise to see you within one business day. We have hyperthermia also, which is a way of heating cancers to help kill cancers. So thank you for listening. God bless you. Have a great day. And our next program, by the way, is at 9 o'clock tonight on WOR. Thank you and God bless you. Bye now.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 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 212-CHOICES.